Hi, I'm Dr. Veena Agarwal. I am a GP ST3, so a final year GP registrar in Southwest London. And I'm going to be talking about why GPs should talk to patients about air pollution and how we can do that. So air pollution is responsible for about 40,000 deaths in the UK every year, which is a really shockingly high number out of the 700,000 overall deaths that we have per year. And one of the issues with air pollution is it affects every part of our body and it affects us at every life stage. So a lot of people think about air pollution as affecting our lungs with things like asthma, COPD and lung cancer. And those things are really important, but we should know that it also affects, even more than lungs, it affects our hearts. So it increases the rates of heart attacks and strokes. It also affects people in pregnancy. So it increases the rates, for example, of stillbirth, of pregnancy complications and low birth weight. It affects children's brain development and increases the rates of dementia. And I could go on. So there are a lot of reasons why we need to be thinking and talking about air pollution. And it's the most vulnerable people in society who are most exposed to air pollution. So it's our children, it's ethnic minority groups and those in more deprived areas who are getting more exposed and suffering the most from air pollution. So what can we do? What can we say to our patients about air pollution? A lot of doctors are very hesitant to talk to patients about air pollution because we think they can't really do anything about it, they think it's a helpless situation and we can't tell them to move house. But my perspective on it is that we should be empowering patients, and actually patients can make changes in their lives if they are aware of what the issues are. So what can we tell them to do? On indoor air pollution, patients can avoid burning anything inside from fires, log burners, candles, and if they do need to use a gas hob, they can make sure they're ventilating the house during or after cooking to make sure that they reduce that pollution coming from the gas stove, which is quite high. We can also help them to take action on mould and damp, for example, by writing to the council and making sure they're aware of their rights on this. And we also need to raise awareness of outdoor air pollution and what patients can do, for example, taking different routes which are via back streets, or for example, walking in green spaces or avoiding peak times. Being outside of your car on the walking and cycling actually reduces your exposure to air pollution, especially when the traffic is heavy. And also making sure you spend time in green spaces. These are things that people can actually do quite easily, as well as, for example, walking on the side of the pavement that is further away from the traffic. All of these are simple things that patients and their families can do. Finally, we should signpost patients to Global Action Plan, which has a brilliant clean air hub, and they have lots of really helpful information for patients about the health impacts of air pollution and what action they can take to mitigate this.